Propeller Health really works in the space of asthma as well as COPD, and in asthma specifically, both across adults and pediatrics. We are able to connect devices, so essentially connect inhalers with sensors, so that not only do parents as caregivers or family members who are caring for an elderly parent have visibility on whether their family members are taking or their friends are taking their medications in a timely fashion, but they also can see the frequency in terms of adherence as it relates to also using rescue inhalers.
So AscendaWave is a pain data company. We've got 9 objective pain databases. And we can also customize pain databases for our customers. We're really focused on 2 things. One is validating your pain, so your pain is believed, and then providing pain data to improve outcomes and to improve the patient experience.
And so what we do is we do 3 things. One is we enable providers with access to over 400 languages through their phone. They access a live interpreter that they can get in less than 30 seconds, some languages less than 10 seconds. Number 2 is we work with organizations through our digital app to help them not just translate, but actually tailor and localize materials based on someone's culture. And so, we'll work with hospital systems to work with a certain population to basically localize outreach materials, so people come in for their vaccines or people come in for their mammographies.
So by placing your finger on a camera, within 90 seconds, we can screen and monitor for AFib with the same sensitivity and specificity of the standard of care. And the way that it works is as your heart is pumping blood, the blood flows through your fingertips, it expands the capillaries, and the pressure changes result in tiny color changes. Now, and our camera picks up this color, and then our AI is able to make the distinction between normal rhythm, AFib, and other rhythms.
What we want to offer is the ability for that provider to instantly connect with a specialist across 30+ disciplines to triage the patient with a subject matter expert. So they hit a button. Median time to connect last month was about 23 seconds. They get matched with a specialist, and they're able to triage the patient directly with that specialist across the multiple service lines. Fundamentally, this solves the access issue. Again, our outcomes are about an 80% reduction in emergency room visits because of the ability to triage it.
So what AmplifyMD is doing, we've created our virtual care platform to provide a comprehensive solution, both from a technology perspective. So first, we're solving the problem of efficiencies, right? How do you practice medicine better and more efficiently, take away the issues with scheduling, care coordination, documentation, billing using our AI and data-driven algorithms. Plus, we've combined that with access, built-in access to over 15 sorely needed clinical specialties across the country, so that regardless of where you are, you get the access to the care you need when you need.
At Duos, we're focused on reimagining the future of aging by connecting older adults and their caregivers to the resources they need to age with dignity. 1 out of 2 every older adults has an unaddressed social need, things like food, transportation, home safety, etc. What we've done at Duos is we have integrated in Medicare Advantage benefits, state, federal, and VA programs, and community-based resources to directly engage with older adults along with their caregivers to then go the final mile and resolve their needs.
In essence, what we're trying to do is we're trying to build a Costco model in healthcare. In essence, really bring managed care to those who can't afford it, primarily individuals and small businesses without access to traditional insurance.
We offer a tech-enabled platform that unifies patient data from across multiple sectors, including EMR data, social determinants of health data, etc. And we use that data to generate accessible, personalized recommendations for every patient on our platform. We have seen health inequity across all sectors of healthcare, and it's our goal to really empower and activate patients and help our clients empower and activate their patients to ensure that they're getting the care they need at the right time, whenever they need it.
We find that people of all races and ethnicities are very interested in participating in research, and that the discrepancies that we see between clinical research participation and demographic is less to do with motivation to participate in research and more to do with barriers to accessing that research. So we're removing those barriers and facilitating better clinical research access for all.
We take a tech bio approach here at Genie by creating a first-in-class therapeutic. And we do this with a platform and a mechanism AI platform that we call Ridge. This has allowed us to take molecules from discovery all the way through clinical development to phase 2 at a fraction of the cost and an accelerated timeline.